If you were born before 1961, or you're turning 65 this year, there is money on the table that most people never claim. And it isn't a check from the government. It's something better. It's the difference between paying $200 a month for your health care and paying $900. And almost nobody explains it to you before you sign the papers. My name is Robert Hale. I spent over 20 years helping people navigate Medicare before I retired myself. And in that time, I watched thousands of good, careful people make the exact same mistakes. Not because they were careless, but because nobody sat them down and explained how the system actually works. The government mails you a letter, gives you a stack of paperwork, and expects you to figure out one of the most important financial decisions of your retirement in a few weeks. That's not fair, and today I'm going to fix that for you. Before we get into it, if you're the kind of person who likes having someone explain this stuff in plain English before it costs you money, go ahead and subscribe now, because this channel exists entirely for moments like this one. Here's the number that gets people's attention, and it's real. Depending on which plan you choose, the gap between the best option for your situation and the wrong one can add up to over $2,800 a year in unnecessary costs, sometimes more, once you count premiums, deductibles, prescription costs, and the specialists you didn't know weren't covered. That's not a government check waiting for you. That's money you keep in your own pocket instead of handing it to an insurance company for coverage you didn't need or didn't understand. Stick with me for the next 15 minutes, because I'm going to walk you through exactly how that gap happens and how to make sure it works in your favor instead of against you. Let's start with the basics, because even people who've been on Medicare for years get this part confused. Medicare isn't one single program. It's actually 4 different parts, and each one does something different. Part A covers your hospital stays, and most people don't pay a monthly premium for it because they already paid into it through payroll taxes during their working years. Part B covers your doctor visits, outpatient care, and things like lab work, and this one does have a monthly premium, which changes a little almost every year. Part D covers your prescription drugs, and this is where I see people lose the most money, because not every plan covers every medication, and the ones that do cover your medication might charge wildly different prices for the exact same pill, depending on which pharmacy you use and which tier that drug falls into on their list. And then there's Part C, which most people know as Medicare Advantage. This is where private insurance companies step in and offer you a bundled plan that often includes A, B, and D all together, sometimes with extras like dental, vision, or a gym membership thrown in. On paper, that sounds like a great deal, and for a lot of people, it genuinely is. But here's what almost nobody tells you when you're comparing these plans side by side. Medicare Advantage plans often use something called a network, which means you can only see certain doctors and certain hospitals without paying extra, sometimes a lot extra, out of your own pocket. If you love your current doctor and that doctor isn't in the network of the plan you pick, you either have to switch doctors or pay significantly more to keep seeing them. I've watched people lose access to a doctor they'd trusted for 15 years because nobody explained this one detail before they signed up. The first big mistake I want you to avoid is signing up for a Medicare Advantage plan just because the premium looks low, sometimes even $0 a month, without checking 3 things. First, check if your current doctors and specialists are in that plan's network. Check if your regular prescriptions are covered and at what cost. And check what the plan actually charges you if you need a hospital stay or a major procedure. because a low monthly premium can hide a much higher cost the one time you actually get seriously sick. A plan that costs you nothing every month but leaves you with a $5,000 bill after one hospital visit isn't actually saving you money. It's just moving the cost to a moment when you're least prepared to handle it. The second mistake, and this one costs people real money every single year, is missing your enrollment windows. Medicare has specific periods when you're allowed to sign up, switch plans, or make changes. And if you miss them, you can face a permanent penalty added to your premium for the rest of your life. Or you might have to wait months before you're allowed to enroll at all. Your initial enrollment period happens around your 65th birthday, and it's a 7-month window, 3 months before your birthday month itself, and 3 months after. If you miss that window and you don't have other qualifying coverage, like an employer plan, you could pay a late enrollment penalty on Part B every single month for the rest of your life. Not for 1 year, for the rest of your life. Then there's the annual open enrollment period every fall, when you can review your current plan and switch to a different one if it no longer fits your needs. Most people never even open the letter that tells them this window exists, and they stay on a plan that quietly got worse without realizing they had options. If this is already saving you from a mistake you didn't know you were about to make, take 5 seconds and hit that subscribe button, because I'd rather you learn this from me than learn it the hard way from a bill in the mail. The third mistake is assuming that because you had employer coverage before you turned 65, you're automatically fine, without checking how your employer plan coordinates with Medicare. Some employer plans expect you to enroll in Medicare Part A and B once you're eligible, and if you don't, your employer coverage might not pay claims the way you expect, leaving you with bills you thought were already covered. This is one of those situations where a phone call to your benefits department before you turn 65 saves you an enormous headache later. The fourth mistake, and this is the quiet one, is not reviewing your Part D prescription coverage every single year, even if you're happy with your current plan. Insurance companies are allowed to change what they cover and what they charge for each medication every single year. A drug that cost you $10 a month last year might cost you $80 this year under the exact same plan, simply because the insurance company moved it to a different pricing tier. If you're not checking this every fall during open enrollment, you could be paying hundreds of dollars more a year for the same pills without ever knowing there was a better option sitting right in front of you. The fifth mistake is not understanding the difference between Medigap and Medicare Advantage and choosing based on which one your neighbor happened to pick. Medigap, sometimes called Medicare Supplement Insurance, works alongside Original Medicare and helps cover the costs Medicare doesn't, like co-payments and deductibles. It usually comes with a higher monthly premium, but it gives you much more freedom to see any doctor who accepts Medicare anywhere in the country without worrying about networks. Medicare Advantage tends to have lower monthly costs but more restrictions. Neither one is universally better. It depends entirely on your health, your budget, and how often you travel or need specialist care. The mistake isn't picking one or the other. The mistake is picking one without actually comparing your own situation against both. The sixth mistake is forgetting to check whether you qualify for financial assistance programs that could lower your costs significantly. There are programs designed specifically for people on a fixed income who qualify based on their income and resources, and they can help cover premiums, deductibles, and prescription costs. A lot of people assume these programs are only for people in extreme financial hardship, but the income limits are often higher than people expect, and I've seen retirees qualify for real savings simply because they finally asked the question. And the seventh mistake, the one that ties all of this together, is trying to make this decision entirely alone, based on a mailer you got in the mail or a commercial you saw on television. These decisions deserve a real conversation, whether that's with a licensed Medicare counselor, a trusted advisor, or your state's health insurance assistance program, which offers free, unbiased counseling to help you compare your options without any sales pressure. I always tell people, the plan being advertised the most isn't necessarily the plan that's best for you. It's simply the plan with the biggest advertising budget. Quick pause here, because I say this in every video, and I mean it every time. If you have a parent, a neighbor, or a friend who's approaching 65 or already on Medicare, send them this video. I promise you, it'll save them more than the 2 minutes it takes to share it. And if you haven't already, go ahead and subscribe, because I've got a lot more of these breakdowns coming, and I'd rather you find them here first. Now, here's the honest truth behind that number I mentioned at the start. That $2,800 gap isn't some hidden government benefit sitting in a drawer waiting for your signature. It's the real, measurable difference between a retiree who reviews their coverage every year, checks their network, checks their prescription costs, and pays attention to enrollment windows, compared to a retiree who signs whatever paperwork shows up in the mail and never looks at it again. The system rewards people who pay attention, and it quietly costs people who don't. Not because it's designed to trick you, but because it's complicated enough that most people never get a clear explanation. Until now. If you take one thing away from this video, let it be this. Every single year during open enrollment in the fall, take one afternoon, sit down with your current plan's details, and ask yourself 3 questions. Are my doctors still in network? Are my medications still affordable under this plan? And is there a better option available now that wasn't available when I first signed up? That one afternoon, once a year, is the entire difference between the mistakes I just walked you through and keeping that money in your own pocket instead. I want to be completely clear about something before we go further. I am not a licensed insurance agent, and this video is not personalized financial, medical, or insurance advice. Medicare rules change, costs vary by state and by individual circumstances, and the right choice for your neighbor might be the wrong choice for you. Before you make any changes to your coverage, please verify current information directly through Medicare.gov or speak with a licensed Medicare advisor or your local state health insurance assistance program, which offers this guidance completely free of charge. My goal with this video is simply to make sure you walk into that conversation already knowing the right questions to ask, instead of hoping the person across the table remembers to mention them. I've spent my career watching good people lose money, not because they made bad decisions, but because nobody handed them the map before they had to choose a road. That's exactly why I started this channel, to hand you that map before you need it, not after. If this video helped you understand something you didn't know before today, do me a favor and subscribe, because every week I'm breaking down another piece of this system that most people never get explained clearly, in plain language, without the sales pitch attached to it. Retirement should feel like the reward you earned after decades of hard work, not another maze of paperwork designed to confuse you. My hope is that every video on this channel gives you one more piece of that peace of mind back, one clear explanation at a time. If you found this useful, hit subscribe so you don't miss the next breakdown, because there's a lot more of this system I still need to walk you through, and I'd rather you hear it here, in plain words, than find out the hard way after the enrollment window has already closed. One last thing before you go. If you're new here, subscribing takes 2 seconds, and it means you won't miss the next video, which might be the one that saves you the most. Take care of yourself, take care of your coverage, and I'll see you in the next one.